Opening up healthcare, a bill making its way through the legislature could let you buy insurance here in Oklahoma from other states. An insurance commissioner here in our state says Oklahoma needs more competition right now to help you pay less. Talking about Senate Bill 478. But then there are the local healthcare organizations saying this could actually leave you undercovered, especially if you get cancer, diabetes, or become pregnant, a whole host of things. And so to chat about this, again, we have Jane Nelsey with us from the Healthcare Coverage Coalition. Thanks for being here with us.
Thank you. It's good to be here.
So on Friday, we heard from the bill's author, Representative Louis Moore, and he was saying what we need right now desperately here in Oklahoma is competition in the insurance marketplace. And he's saying that this bill is the way to do it. What is your major concern with this bill?
Our major concern with this bill is that it would render most health care in Oklahoma useless, because it would eliminate all the patient protection benefits that we have here in the state.
Talking about the mandates.
Yes.
Okay.
Well, we call them patient protection.
Sure. So just to be clear for our viewers, the mandates are, there's a list of 38 things that the state says every insurer must cover. And they run the gamut from everything from ambulance rides to emergency room visits to, birth health care for newborns and things like that.
Correct. And people expect, when they're diagnosed with a disease such as diabetes, cancer, or Alzheimer's, they expect their health care insurance to cover the treatment and the diagnosis of those diseases.
Sure. So I want to play a clip for our audience real quick of what Representative Moore said about these mandates and what he's kind of envisioning here.
Those people on the individual plan, they could decide, I don't need these type of coverages. I'll choose one with 25 mandates, which would lower the cost.
So he's saying right now, if you're an individual, for instance, if you think you're a very healthy individual, you could get rid of the diabetes coverage, and that could perhaps lower your cost of health insurance, or get rid of some of the other mandates that you don't think you need. Basically an a la carte healthcare plan.
Well, I don't think anybody plans to have diabetes or be diagnosed with those diseases. So if they had a health insurance plan that didn't cover those kinds of diseases, they wouldn't have coverage when they were diagnosed. And so the money that they've been paying into that. I think I need to make clear here that Senate Bill 478 does nothing to contain costs. There are no limits, and there's no cost containment in the language that Representative Moore has in this bill.
So Representative Moore is saying, through the fact that you may have fewer mandates there, he's saying he thinks he could bring down premium costs as much as 30%. That's his numbers.
Well, there aren't any examples. There are 5 states that have already passed legislation like this: Rhode Island, Kentucky, Georgia, Wyoming, and Maine. None of them have had insurance companies that have crossed state lines to sell insurance in their states. So there's no examples. And Rhode Island has had this language in place since 2007.
And no one's gone in and sold across state lines.
Correct. I think it's, you can look at insurance in another state and say, wow, that's less than what we pay here. But you can't necessarily take that policy and bring it to Oklahoma and have it be the same cost, because there are other pieces that are included in that. Those out-of-state insurance companies have to come in and find provider networks. They, whether it's a hospital, physicians, advanced practice nurses, other kinds of providers, that's an expensive proposition to do.
And Oklahoma isn't necessarily the most attractive pool for insurers to come in. We have a lot of chronic disease. We have a small population, and a population that it ranks low in terms of health, which makes it harder to attract insurers.
That's correct. We're ranked 49th in health outcomes, which does not make us a healthy population. We're also second in the nation for mental illness and substance abuse. So these policies would actually separate the risk pool. So if you look at the way insurance is built, it takes into the fact that you spread the risk across healthy and unhealthy people, enrollees, and it spreads that. This insurance would separate the healthy from the unhealthy, thus making those risk pools with the unhealthy, unfeasible.
Sure.
And leave those people bare.
Okay, I want to ask you about the autism coverage, because a lot of people have been writing in about questions about that. And then also, if this isn't the solution, what is? And we'll talk about both those things in a moment here.